My name is Hannah Ma, and I am taking the time to reflect on my clinical learning in this presentation of clinical integration and professional development. And I'd like to start by saying that it's been really an honor and a privilege to look back at the growth that I have made in the past almost year of being in practicum at my site. So I'm going to utilize the presentation to reflect on my strengths and the areas that I have seen myself grow clinically, as well as areas of professional growth and development, and how I will integrate the learning and move forward. So as for my strengths that I have seen myself and seen myself growing in are as follows. In ethical clinical decision making, I've really kept in mind the code of ethics that we have been learning about time and time again with work with each of my clients and every session that I am in. And I am constantly monitoring to make sure that every session is focused on them and being mindful of transference and countertransference that may occur and deciding when disclosure may be actually helpful, always focused on the client and their welfare and their benefit. And that is through the ACA Code of Ethics that I'm referencing. The culturally responsive practices that I have been engaging in, and I have made tremendous growth as I've worked with such diverse clientele, ranging from like really diverse students, young as 9 years old to elderly, over 70 years old, and also diverse in gender, ethnicity, background in terms of education, career, economic status. I've learned so much from them, and it really incorporated the competency of culturally responsive practices in really learning their context and being able to apply some of the problems that they may have, which may be related to some of the cultural factors. And so I work with them on identifying those and navigating them. For example, two of my clients that have ADHD symptoms, and they're diverse in age, and with my young client and my older client, I was able to bring up the ADHD 2.0 book by Hallowell and Rady and talk about how some of the traits that they have that have been only been seen as problematic may actually be useful. And highlighting those have really helped to kind of push forward in their thinking about themselves, having some sense of self-awareness and utilizing some of these traits that they do have as something that they can use for their benefit. So I have been able to also grow in psychological and professional literacy and utilizing those and turning it into building my intervention skills. So, for example, in my learning about the various therapeutic strategies and concepts, I have seen how cognitive behavior therapy, time and time again, helps to manage some of the acute symptoms of anxiety, and that can be seen by the study by Papola et al. And so with clients that I have that have generalized anxiety disorder, I have one particular that's coming to mind right now. I've been able to provide psychoeducation as well as work on tools during session and teaching them how to use it outside of sessions, and tools that are mentioned at Kress et al. Textbook and the CBT online source called CBT for Cognitive Distortions that have been really helpful. I have also demonstrated strong communication skills in working with my clients, both orally and written, and growing in my professional development. So, for example, in working with a couple, I have really made it clear that the client is the two of them as a couple, and that I do not take sides or I don't referee about any of the incidents that they may have had conflict over. So rather than that, I teach them some of the skills on problem solving and also being able to communicate well. And so that is really reflected in Sperry and Peluso in working with a client as and being very careful about who the client is and communicating that. Gottman and Silver book has been really instrumental for me for helping with psychoeducation of this couple and working on the problem solving skills and communication skills with them, and utilizing micro skills in my sessions with clients, both this couple as a client as well as all of my individual clients, in utilizing those skills of paraphrasing, summarizing, open-ended questions, appropriate closed-ended questions, etc. Those have been really helpful and helping me to build my skill set. And in terms of assessment, I have really learned a lot about the appropriateness of different assessments. But overall, the comprehensive assessment strategy is really helpful, which includes understanding the client's background and their history, childhood history, family history, educational history, career history, that are really helpful in understanding the context for my client that is bringing some of the symptoms as problems that they want to work on. And so usually that comprehensive assessments are very, very helpful. And that's pretty much kind of the approach I take. But there are some very specific assessments that are absolutely needed in certain moments. For example, crises of suicide risk. I have applied those risk of suicide assessment by Columbia to utilize with at least a couple of my clients. And the sources that I am citing are from Drummond et al. And ACA Code of Ethics. My supervision has been an area that has really helped me to grow as a clinician, and my supervisor has really helped me with corrective feedback, with guidance on specific cases. And so, for example, I understand that when working with children, it is really important to consider the family context, the family systems, and involve parents early and often, and communicate clearly how their role is really instrumental in helping their children's wellness. And so I've been utilizing that along with communication skills, making sure that I'm communicating very clearly with both sets of parents if they're both at play here. And interprofessional collaboration, I have been really fortunate to work closely with my clinical coworkers, and I have some clients that are connected relationally to other clinicians at my clinic. So we converse regularly. We talk about how we can better support each of our clients, and that can be really helpful by referencing Russell Chapin et al. And so my areas of further development is that I seek to continue to receive feedback and growing from them. I am happily continuing on the same site as a AMFT, and so I would look forward to really learning about just more difficult cases that I may have and bringing those forward in bringing it to get feedback. Again, Russell Chapin et al. Is my reference. The challenges that I encountered are many, and as definitely a beginning clinician, but I would say more than anything, my self-doubt and my sense of imposter syndrome have crept in time and time again, especially at the beginning part of my clinical journey. And I do know that it is part of a normal development, so that has been helpful for me, and that work is cited by Siddiqui et al. Adapting different theoretical perspectives, I know that it can be appropriate to just utilize one type, especially for specific problems that clients need to address, such as CBT and DBT, but that oftentimes integrating with other theoretical perspectives are very beneficial, such as psychodynamic. My professional growth through the challenges I know come through self-awareness, analysis of my clinical skills, and really bringing them forward through to supervision sessions. And in terms of moving forward in integration and forward planning, and again, I plan to utilize my self-awareness and what I've learned about emotional regulations during sessions and transference and countertransference to really understand myself as a clinician, see what I bring into the sessions in relation to my clients, and really utilize that knowledge for building my clinical skills and really building rapport with my clients. And again, with my supervision, I plan to really refine my clinical judgment, and that is how I will really apply all that I have learned into practice. And the professional standards that I am seeking to continue to grow in is that I will seek to learn through resources and from others' experiences, and really just keep updated on the ethical, legal, and professional competence and cultural competence through being part of an organization, professional organization such as the California MFT, and to read up on the laws, California laws as it pertains to our clinical profession, like from Caldwell. So in conclusion, I am committed to keep growing as a clinician. I'm so fortunate for this past almost year of practice, and I seek to grow as an MFT in the same site and really practice all that I have learned and continue to build on that. I know that I can keep learning and growing. So I have seen that for myself, and I look forward to more of that. Thank you.